Morning, dear students. Next topic for discussion in our nursing education class is the historical development of nursing education in international, national, and state level. Okay, so this topic is already studied in first year basic nursing classes, but as a revision or as a review, we will be discussing again in nursing education classes also. So we can see the nursing curriculum, how this historical development of nursing curriculum has happened in an international level, that we can see first. So historical development of nursing curriculum. So this history is according to Olivia Beavis and Jean Watson. Okay, so formal nursing education and curriculum can be traced to 17th century and French Sisters of Charity. So 17th century onwards, nursing curriculum was the nursing education training was there for nursing, and it was run by French Sisters of Charity even in 17th century. Until this time, so till 17th century, what was happened is untrained helpers, mostly servants, were nurses. Like rich people, they will be having servants, and they were supposed to take care of sick people in this rich family. When the order was formed in 1633, the prescribed course of study was a 2-month probationary period followed by 7 to 8 months of instruction and supervision. The instruction consisted lectures, quizzes, and religious exercises. So, according to history, there was an order for this nursing instruction was formed since 1633, and there was a period of 2-month probationary period followed by 7 to 8 months of instruction and supervision. So altogether total of 10 to 12 months of instruction was developed during 1633, and before there were no curriculum or there was no instruction as such. The servants were treated as nurses, and they were supposed to take care of the patients or sick people. So this instruction was started in 17th century, that is 1633, by French Sisters of Charity, and they have given 7 to 8 months of instruction, supervision, and 2 months of probationary period. And the instruction was in the form of lecture, quizzes, and religious exercises, because it is run by French Sisters of Charity, so some religious education was also given during this period. And a significant advance in the nursing curriculum, and again according to Beavis and Watson, occurred in 1860 due to the influence of Florence Nightingale. So a major drastic change in nursing curriculum, nursing education, was started by or initiated by Florence Nightingale, as we know, and in 1860. So the curriculum was changed from the previous curriculum, which was run by French Sisters of Charity by Florence Nightingale. There was a year of training and a probationary period followed by 3 years of hospital service. So there was 1 year of training, instruction was given, and after that 3-year students has to practice in the hospital. That was a training session which was put forward by Florence Nightingale. So altogether of nearly 4-year training was given for nurses by Florence Nightingale. Initially it was 10 to 12 months by Sisters of Charity, French Sisters of Charity, and after 1860 Florence Nightingale has put forward another training program which consists of total of 4 years of training, 1 year of training and 3 years of probationary period, altogether 4 years of instruction. And during this time, the curriculum was based upon the development of 12 personal characteristics and 13 functions and skills. So she has focused on 12 plus 13 characteristics. So 12 personal characteristics should be there for a nurse, and 13 functions and skills. So that may be one dressing or some bed making. So simple skills were initiated by Florence Nightingale. 12 personal characteristics has to be developed during this time and 13 functions and skills. Most experts consider it as a well organized and highly structured curriculum, and it was accepted worldwide. So during that time, this curriculum was accepted worldwide because they believed that it was something systematic and structured. So this is about the Nightingale model on curriculum of nursing education. Then after that, certain curriculum guides was developed. So this is again one more turning point in the development of nursing curriculum, that is the formation of curriculum guide. And this is also from, according to Bevis and Watson, they tell that there is a curriculum guide was developed, and it was again one more turning point after the Florence Nightingale activity. And in 1917, the Education Committee of the League of Nursing Education produced its standard curriculum. So that was a curriculum guide was developed by Education Committee of the League of Nursing Education. So it named as a standard curriculum. It was designed to help nursing school improve their programs and standards, as nursing requirements were minimal and not uniform. So to make a uniformity in nursing schools, they have put forward a standard curriculum or a curriculum guide to establish a minimum standard to all institutions, because during that time the instruction was not uniform and the requirements were not minimal, at least minimal requirements were not met by many of the schools of nursing. So that's why they started a standard curriculum. So the work defined objectives, content and method of each course. It provided a list of needed materials, equipments and bibliography. So these are included in the curriculum guide. So in 1917, they have given a standard curriculum, and in that, what are the objectives, what are the content to be taught in nursing education, and methods of teaching for each course, like what all the procedures, list of activities, everything was given in the curriculum guide. And needed materials and equipments, bibliography, everything was listed in the curriculum guide, which was established in 1970. And this curriculum guides was revised in 1927 and 1937. So this is about the another turning point, that is curriculum guide. The standard curriculum was developed, which includes the objectives, content, methods for each course, and the needed materials and equipments, bibliography, textbooks, reference, everything was given in the curriculum guide. The minimum requirements was given. Next is this about the colleges and university. The most significant advance in the nursing curriculum came when institutes of higher learning adopted nursing education programs. So during this time, many of the institutions, universities accepted nursing as a course in their university, and according to the studies of Mildred and Montague, who designed a 2-year course of study for technical nurses in the late 1940s and 1950s, many two-year colleges developed associate of arts degree programs. So many of the colleges started, like along with arts degree program, nursing education also they started in colleges and university. So many of the colleges and university accepted nursing education program during this time. Shortly thereafter, colleges introduced baccalaureate programs that based a professional nursing education on 2 years of prerequisite courses and liberal arts. So shortly, School of Nursing were run by hospitals, and slowly colleges were taken up this college program, or as a college program, baccalaureate nursing programs were started, and college based programs and expanding curriculum saw a geometric explosion or a rapid rise in the number of nursing programs in higher education from 1950s to 1970s. So during this time, colleges started baccalaureate programs and university accepts the programs. So during 1950s and 70s, more baccalaureate nursing programs and acceptance of this degree program was happened during 1950s and 1970s. So this is about the nursing education in international level, how the curriculum was developed in international level. So hope you all understood the explanations, and will continue in the next video.